Here's a number that should stop every single educator in their tracks. 1 in 5 young people in England is living with a probable mental health condition right now. 1 in 5. That means in a class of 30 pupils, statistically 6 of them are struggling, and many of them won't tell you. They might not even know themselves. Hi, I'm Anna, and you're watching Excell Connect, the channel for teachers, TAs and school leaders across England and Wales who want real, practical support for doing one of the most important jobs in the world. Today we're talking about mental health first aid in schools. What is it, why it matters more than ever, and what you and your school can do about it. This is a topic that's really close to our hearts at Excell Supply because we work with hundreds of schools every single week and we see the pressure that staff and pupils are under every single day. So, let's get into it. Before we talk about solutions, let's make sure we all understand the scale of what we're dealing with. In England, the NHS found that 1 in 5 young people now has a probable mental disorder. That figure was 1 in 9 back in 2017. So in under a decade, we've seen those numbers more than double. Of those young people who need help, only a third are currently able to access it. That means 2 out of every 3 children who are struggling are not getting the support they need. And in 2023, around 40,000 children and young people waited more than 2 years for mental health support. Now, if you're watching from Wales, which many of you are, the picture is just as serious. At one point in 2024, children in Wales were waiting close to 2 years just for a first CAMHS appointment. 2 years. That's most of a secondary school year group. The Welsh Government has taken significant steps, investing over £3 million in school counselling services in the 2025 to 2026 financial year alone. And the NYTH framework is working to bring services together in a more joined up way. That is progress, and it really does matter. But here's the reality. Professional mental health services in both England and Wales are under enormous strain. Waiting lists are long, CAMHS capacity is stretched, and in that gap, in between a child struggling and a child finally getting professional help, the school is often the only safety net. That is not a criticism of the system. It is simply the reality that school staff face every single day. And it's why what we're talking about today matters so much. So, what actually is mental health first aid? And what's the difference between that and just being a supportive teacher? Mental Health First Aid, or MHFA, is a structured, evidence-based training programme that equips people with the skills to recognise the early signs of mental health challenges, respond with confidence and connect people to the right support. It doesn't turn teachers into therapists. That's important to be really clear about. MHFA is about the first response. Just like physical first aid is about stabilising someone until the ambulance arrives. It's about creating that bridge between noticing something is wrong and getting someone the professional help that they need. In school specifically, there's a version called Youth MHFA, which is tailored specifically for working with young people aged 8 to 18. It uses school-specific scenarios. It accounts for how mental health presents differently in children and young people, and it integrates with the safeguarding procedures and SEND support systems already in place in your school. The training itself is 14 hours, usually delivered over 2 full days, and gives participants a recognised qualification that's valid for 3 years. Staff who complete it are officially accredited mental health first aiders. Training providers in England must be accredited through MHFA England, the official national body. In Wales, organisations including MHFA Wales and St John's Ambulance Cymru offer accredited provision. The NASUWT Teachers Union also offers approved MHFA courses in both England and Wales. So, who should get trained? Ideally, any staff member who has regular contact with pupils. That could be a pastoral lead, a learning support assistant, a form tutor, a head of year. The goal is to make sure there's always a trained MHFA person available throughout the school day, not just in term time, but in the places and moments where children are most likely to reach out. MHFA training is built around a 5-step action plan called ALGEE. It's simple enough to remember in a corridor, in a classroom, on a schoolyard, wherever you happen to be when a young person needs you. So, let's walk through it. A. Approach the person, assess and assist with any crisis. This is about recognising something isn't right and taking the first brave step to check in. Not waiting, not hoping someone else will do it, approaching. L. Listen non-judgmentally. Young people who are struggling are often terrified of being judged or dismissed. This step is about giving space, not jumping straight to solutions, not minimising what they're feeling, just genuinely listening. G. Give reassurance and information. Let the younger person know they're not alone, that what they're feeling is valid and that support is available. Provide clear, age-appropriate information about what help exists. E. Encourage appropriate professional help. MHFA isn't the endpoint. The trained first aider's job is to help connect the young person to the right next step, whether that's a school counsellor, the SENCO, a GP, or another appropriate service. E. Encourage self-help and other support strategies. Alongside professional help, supporting young people to access peer support, trusted adults, or self-care strategies can make a real difference in the short term. Now, where does this fit in policy terms? Because we know that for school leaders, what drives action is often what's expected from Ofsted, the Welsh Estyn, the DFE, or the Welsh Government. In England, the Department for Education has been clear. Schools should have a designated senior mental health lead, a trained member of staff with strategic oversight of the whole school approach to mental health and wellbeing. Between 2021 and 2024, the DFE offered a £1,200 grant for eligible state schools and colleges to fund that training. That grant scheme has now closed, so if your school hasn't yet taken it up, it's worth checking with your local authority for any current support available. Mental health support teams funded by NHS England are also being rolled out across England. As of 2024 to 2025, they've projected to cover around 54% of pupils and 42% of schools and colleges. That's significant progress, but it also means nearly half of pupils are still not covered, and MHFA training in school fills exactly that gap. In Wales, the approach is shaped by the NYTH Framework, a 10-year mental health strategy that joins up services from school to CAMHS to community support. The Welsh Government is funding school counselling services directly, over £3 million in 2025 to 2026, and CAMHS in Reach to Schools is a key part of the delivery model. Welsh schools operating under the Curriculum for Wales also have a statutory duty to promote health and wellbeing, which includes emotional and mental wellbeing. Neither England nor Wales has actually made MHFA training a legal requirement for schools as of yet. There is a first aid for mental health bill progressing through UK Parliament, and its progress is worth watching. But here's the thing, many of the most forward-thinking schools aren't waiting for legislation. They're training their staff now because they can see what's in front of them every single day. Now, I want to speak directly to anyone watching this who is a supply teacher or teaching assistant, because this part is for you specifically. When you're covering a class, especially when you haven't taught before, you don't always have the context that a permanent member of staff would have. You might not know which pupils have SEND support plans. You might not have read every safeguarding note in the file, and yet a young person having a really hard day doesn't know or care that you're a cover teacher. They just know you're the adult in the room. That's both the challenge and the privilege of supply work. MHFA training gives supply staff, not just permanent staff, the confidence to respond calmly and appropriately when these moments happen. To know what to say, to know what not to say, to know who to tell and what to do next. As At Excell Supply, we're genuinely committed to CPD for all of the teachers and TAs on our books, not just the ones in long-term placements, but everyone. Because we believe that every person we place in a school should be equipped to support the whole child, not just deliver a lesson. If you're already registered with Excell, speak to your consultant about what training opportunities are available to you. If you're not yet with us, well, this might be a good time to start that conversation. So, what are the practical next steps? Whether you're a classroom teacher, a TA, or a head teacher watching this, here's what you can actually do. Number 1, find out what MHFA provision already exists in your school. Do you know who your trained mental health first aiders are? Where the list lives? Who to call if a situation arises? If you don't, find out this week. 2, if your school doesn't have trained MHFA staff yet, champion it. Bring it to your SLT. Bring it to your governing body. Frame it as safeguarding. Frame it as well-being. Frame it as staff confidence. Use the statistics from this video. The case is there. Number 3, choose an accredited provider. In England, any provider must be accredited through MHFA England. In Wales, look for MHFA Wales or St John Ambulance Cymru. The NASUWT also offers accredited courses in both nations. Training costs approximately £800 per person, but the return on that investment in staff confidence, early intervention and pupil outcomes is enormous. 4, plan for sustainability. One training day doesn't create a whole school culture. Think about who else needs training. How do you refresh skills after 3 years? How does MHFA link into your safeguarding policy, your SEND support, your pastoral care system? Mental health isn't a pastoral afterthought. It's at the heart of everything we do in education. How children learn, how they relate to each other, and whether they thrive. Schools in England and Wales are doing extraordinary work in incredibly difficult circumstances. And every teacher, TA and support member who takes the step to get MHFA trained is adding another layer of protection around the young people in their care. If today's video was useful, please like and subscribe. It genuinely helps this channel reach more educators. Drop a comment below if you've already done MHFA training and let us know what difference it's made. We'd love to hear from you. And if you're a teacher or TA looking for supply work in North Wales, Chester, the Wirral or Shropshire, you can find out more about Excell Supply at excell-supply.com. We're a Welsh Government preferred supplier and we'd love to support your next step. See you in the next one.